Thank you, Morgan, for agreeing to meet with me today. It was such a pleasure when I ran into you at the seniors show several weeks ago. So I was really intrigued by what you do. And it really took me back to my home care days when we went in with clients and, you talk about all the ADLs that you're going to do. And you just feel like foot care is going to be part of it. But we are also at sometimes we had men that didn't want to take their socks and shoes off. So, it just runs the full gamut. And some people really wanted their feet done. There's also a fine line as to how much should an aide attempt to do when they're working with a client that has any type of a condition, really. So that was another thing as a nurse that I had to pay attention to let them know um, about cutting nails or whatever. They're trained in some way to do that, but every client is different. So that's
Yes.
why I felt it was so interesting that I saw you and what you do. And I wanted you to give us a different vantage point of how you see that and some of the problems you've run into. But first, introduce yourself and tell us what you do.
Sure. So my name is Dr. Morgan Womble. I've been a nurse for about 13 years, and 10 of those years I still am a certified wound ostomy continence nurse. And I've been working as a nurse practitioner for UNC Geriatrics for UNC Health for the last few years. But in my experience as a wound nurse, I noticed a lot of issues with the feet. That was in the hospital setting and even in the outpatient setting. And so I decided that I would open up a small mobile foot care business in order to help serve folks who have transportation or mobility issues. Because a lot of people can get out, if you have a ride to the doctor, you can get out to a podiatrist to get your foot care and foot health addressed. But people who maybe can't get out or maybe don't want to go to a local nail salon because they have diabetes or peripheral vascular disease, they're limited in who they can go see. So I decided to open up a small business called Womble's Wound and Foot Care Solutions in order to meet that need and bridge the gap there. So I started the business a couple of years ago, and we basically go all over the Triangle and surrounding counties to provide in-home foot care services for folks. We are private pay only, so we're unable to accept insurance, but we feel our rates are very reasonable, not much more than a nail salon, and we're traveling to our clients. And so my staff are registered nurses, they're certified wound ostomy continence nurses, or registered nurses with a foot and wound background. So we're all medically trained, which is also important, as you're saying. Sometimes people have conditions that you might not want a CNA addressing simply because it's not within their scope. And then, as we all know, some people just have very thick, challenging toenails. And so it's really hard to manage that unless you have the right tools. So,
Absolutely. So tell us why the feet are so important and why we need to pay attention to them.
yeah. So, I mean, they're your foundation, right? Without your feet, you're not going to get anywhere. You can't do anything. Um, and so I think making sure that we pay attention to foot health, it's often overlooked, which is kind of unfortunate. The last thing that people do is probably take someone's socks off and look at their feet. But pain is a big thing. If you have really thick corns or calluses, or even really thick toenails that are maybe curving into the skin, that can certainly affect your quality because you're not going to be able to get around as well. And in our geriatric population, that can lead to falls. So number one thing that really can cause a downturn in someone's health is a fall, especially when you're older. So if we can address the foot health, hopefully we can help, prevent the falls just by making sure that patients' feet are maintained.
One of the things that we usually had to address with clients would be the shoes that they wear in the home, even when going out. But a lot of them are used to wearing these shoes that they slide their feet into and they don't have any hook or anything on the back. And as they get older, they just don't have the balance and the agility to stay on those pretty little slippers. So, can you talk a little bit about how the correct shoe means so much with foot care and balance?
So you asked about, footwear and balance. So we usually recommend something with a wider toe box, but a sturdier shoe. I do see a lot of folks that get these slip-ons, and while those are okay, it just depends on the person and their gait, their mobility. So if somebody's pretty unbalanced, I would prefer them to have a sturdier shoe, maybe with Velcro straps. But that being said, a lot of people have foot deformities or overlapping toes or hammer toes, which can cause pain. So if you have a really rigid toe box, sometimes that can be problematic for them too. So it really is individualized. And that's why our team can come in and look at the shoe. You can say, hey, this one might work for you, but this one might work for somebody else. So we can tailor the needs of, each client to the foot. So it depends. But you definitely want something with a nice sturdy base, like on the bottom. You want to make sure that it's got some type of rubber so that they're not going to slide. Because sometimes with the shoes that you can slip into, they may not be as high of quality, but it's mainly the surface on the bottom. If it's slick, that can lead to falls. So that's important too.
So if a home care agency had a situation where they looked at someone's feet and they knew it was really something that they couldn't do at all and they needed someone like you, how does that referral process come about?
So we're a small, family owned business. I own the business. I have several of my family members who are nurses who actually work for me. So we make it pretty easy. You just call me and schedule an appointment. I do have an online website, but it's easier just to call and make an appointment with me because my clinicians are going all over. And so it's hard to do it online because I'm trying to make sure that my clinicians aren't driving, an hour this way, 30 minutes this way. I try to cluster the appointments. So calling me is the easiest way, or texting.
Well, home care agencies certainly understand that because you're sort of in the same business.
Exactly. Yeah.
Yes, they understand the scheduling and all of that. So if you come in for a referral, is there an initial fee for
Not
the
for, I mean, the fee is the same with each visit. It might change depending on the complexity of the toenails. So yeah, the fee is just dependent upon the nails. There's not an actual referral fee.
how about for a consultation?
As far as the foot care, do you
Yes.
mean like over the phone or?
Or if you came out to look at someone's feet and they decided maybe that they didn't decide not to use it, but is there a way that you can look at someone's feet before they decide to actually sign on for the service? I guess that's what I'm saying.
Okay. It depends. So we can take care of almost any type of toenails. So we can even do early ingrown toenail management. Now, if something is infected or if someone's having like a lot of pain, redness, swelling, or even drainage, that's when they need to be seeing their primary care doctor or their podiatrist. So I usually pre-screen people when they call me, or folks are really good at saying, hey, they're having a lot of pain. And then I'll ask more questions to make sure it's appropriate for us to see the patient. Generally, if we go out, we kind of expect that we're going to be taking care of most of the toenails. Even if there's, say, one toenail that maybe is problematic, generally we can trim it to kind of fix the short-term problem. And then we'll say, hey, we think you should see a podiatrist for maybe a removal of that nail, which we don't do in the home, and that's not within our scope. So that's where we draw the line. But usually we pre-screen.
Exactly. So how can home care agencies actually work with you? How would you prefer that they work with you? We talked about the referral, but how do you see synergy between yourself and what home care agencies do?
What I love about home care agencies is that everybody is so involved in their patients. And so they're really looking out for their best interests. So, I'm usually very open with communication. So if somebody calls and has an issue or a problem, I will take whatever time that whatever time we need to take to talk about the individual client. But as far as the communication, someone can call me anytime, even if they have just questions. I'm very open to helping out because ultimately it's about our patients, right, and our patients' health. So if it takes a couple minutes out of my day just to have a conversation, I'm absolutely fine with that.
Thank you. Is there anything else that you would like to tell home care agencies about you, what you do, and how you can work together in the future?
Sure. So, in addition to having this foot care business, I actually own a separate business for folks who have chronic wounds. So it's called Soul Skin and Foot Specialists, and I just opened it this year. And so the intention with that particular company is to actually do synthetic skin grafting for individuals who have chronic wounds greater than 30 days. Maybe have had really good local wound care and just the wounds won't heal. A lot of bed sores or pressure injuries. It's kind of my bread and butter from my wound care days in the hospital. We saw lots of really bad pressure injuries or lower extremity ulcers or diabetic foot ulcers. And so, what this allows is a little bit different of an approach and a little bit of what I would say an advanced treatment modality. The skin substitutes are expensive, but the patient, if they have Medicare Part B, generally doesn't pay anything. So that's kind of the caveat is that in order for me to see those patients, they have to have Medicare Part B. So if you happen to have somebody who has a wound that's been there for at least 30 days and not getting better, I can usually come in and take a look and evaluate the wound. So that's my other side business. But I will say that within the Womble's Wound and Foot Care Solutions, we're actually offering a virtual wound and ostomy consultation service. So that is something that we do. Again, that is private pay. So again, separate from the skin substitutes. But if people have questions about pressure injuries or ostomy care needs, we're able to set up a Zoom like this and discuss the patient, the situation, and it's very reasonably priced.
Thank you. That is wonderful. I'm just so happy that we met and that we could get together today and talk about what you do because I certainly feel like had I known about someone like you when I was putting aids in the home, I certainly would have called you to, consult to look at some situations and probably, take care of some things in conjunction with the family. Because a lot of families are taking their family members to nail salons, but the nail salons are not trained in what you're trained in, but some of them will attempt to do things that they really shouldn't do. I've seen that before. So we'd
Yeah.
rather them come to you because you're looking at that client holistically, what their conditions are, because that's just what you do. And a nail salon just sees a foot that needs this, and that, and they see a difficult nail that needs to be cut, and they just keep cutting. So that can really be a tough situation. So I'm happy to know about you. I'm sure the home care agencies will be glad to know that you're out there. And I really appreciate you having this conversation with me. Thank you
Oh,
so much today.
thank you so much. It was really nice to chat.